Osteogenesis Imperfecta by Carla Flores, Genetics 2600. What is osteogenesis imperfecta? It is a hereditary disease that causes bones to shatter rapidly, often for no apparent reason. It is mostly brought on by mutations that impact the synthesis of collagen, a crucial protein that gives bones their strength and shape. It is often called brittle bone disease. Chromosome loci for osteogenesis imperfecta. Evidence suggests that osteogenesis imperfecta results from mutations in the COL1A1 and the COL1A2 mutations. These are responsible for more than 90% of all cases of osteogenesis imperfecta. The most prevalent protein in bone, skin, and other connective tissues, type 1 collagen, is assembled using proteins that are made possible by these two genes. Epidemiology. The disorder occurs in an estimated 1 out of 12,000 to 15,000 babies. Inheritance. Primarily autosomal dominant, rarer types are autosomal recessive. Gender affects males and females equally. Race. No racial or ethnic preference. Age. Severe types are present at birth, while mild cases may emerge later in childhood or adulthood. Signs and symptoms. Type 1 is the mildest form of the condition. People with this type have bone fractures during childhood and adolescence, often due to minor trauma. Type 2 is the most severe form of osteogenesis imperfecta. Infants with this type have bones that appear bent or crumpled and fractured before birth. They have short bowed arms and legs, hips that turn outward, and unusually soft skull bones. Infants with this type are stillborn or die shortly after birth. Type 3 also has severe signs and symptoms. They have very soft and fragile bones that may begin to fracture before birth or in early infancy. Some have rib fractures that can cause life-threatening problems with breathing. Bone abnormalities tend to get worse over time and often interfere with the ability to walk. Type 4 is the most variable form. It can range from mild to severe. About 25% of infants with type 4 are born with bone fractures. Others may not have broken bones until later in childhood or adulthood. Treatments. There is currently no cure for osteogenesis imperfecta, but there is treatments that involve supportive therapy to decrease the number of fractures and disabilities that help with independent living and maintain overall health. Supportive therapy is different for each person, depending on the severity of their condition and their age. Another form of treatment is called intramedullary rodding. This means placing rods in the bones. It is used to help with positioning of the legs that helps with more normal functioning when necessary. Images of chromosome and treatments. Here I have a COL1A2 antibody picture and an intramedullary rodding picture of before and after they placed the rods in the legs to help. And these are my references.